The endoscopic carpal ligament release contrasts with the open release only from the standpoint that the technique is a little bit different. So when we do the endoscopic procedure, we're doing it through a smaller incision. It avoids the palm of the hand. It's made in the wrist area. So from a technique standpoint, it's a little quicker and the recovery long-term is a little faster. The endoscopic approach is different from the traditional approach in that in the endoscopic approach, since you're under the ligament, you're cutting it from the inside out and you're just cutting the ligament. When you're doing it in the traditional fashion, and that's the way it's done in 90 to 95% of places, you actually have to go through the skin, through a little bit of palm fat. You're making an incision in the palm, and then something called the palmar fascia is another layer of tissue you have to cut into before you get to the ligament and cut it and then close the skin. So it takes a little bit longer, but because that incision then is in the palm, people have a little bit more tenderness in the palm, and the recovery ends up being a little longer, and it's a little more uncomfortable as well. So the most common reason why an individual might need carpal tunnel surgery is the fact that they're complaining of numbness and tingling, most commonly and classically in their thumb, index, and middle fingers. But that numbness most often occurs in different types of activities during the day and at night. So the biggest benefit in doing an endoscopic carpal ligament release is it's less painful and the recovery is faster. And if it's one hand, most of the time they can go back to work or their normal activities within about a 4-week time frame, maximum 6, compared to the 6 to 8 week time frame with an open procedure.